So if there is not enough bone for a dental implant, what are the things one need to be careful of when undergoing a sinus lift? So what the person means by sinus lift is a type of bone grafting some patients need when they are going to need a dental implant. This is the most common occurrence that happens in the back teeth on the upper jaw, right here, either on the right side or on the left side. So whenever you lose some teeth in the back, so the sinus always encroaches upon the space that teeth used to sit on, and now you're going to end up having to have what we call it as a sinus lift procedure or a sinus bone grafting procedure to be done. So the longer you're going to wait after the back teeth are extracted, the chances of you to have a sinus lift is very likely. So you want to have, anytime you have a back tooth extracted, you want to get the dental implants placed as soon as possible, like maybe about 3 to 6 months or like a 6 months to a 9 months window. Otherwise the chances of that happening, the chances of you needing a sinus lift is very high. As far as what are the complications that could happen, or what kind of things that someone need to be careful of, you will need to talk to the implant specialist or the implant surgeon, whoever is going to be placing the implant. For the most part, the sinus lift is a very, very, very safe procedure. Most patients do not have any complications at all, and I've been doing this procedure for almost over 20 years now, and I have not had, knock on wood, I have not had any patients with serious complications, although I see like some patients have some kind of a chronic sinusitis, and sinusitis, it happens for a while again, and then it tends to kind of go away. Again, you have multiple factors that you're dealing with. I tell my patients all the time, hey, here we go. We live in Texas. Sometimes we have a temperature ranging from, weather goes down from 20 degrees, one day, and then next day we got 80 degrees. We got weeds all the time, in the pollen all the time in the air. That could be contributing to the sinusitis you have, not necessarily like you had a sinus procedure done, which sometimes patients have a tendency to, they have a sinus complication, they try to relate it to a sinus procedure. But long story short, anytime you have a sinus procedure done, a sinus lift bone grafting done, about 99% of the time, in my opinion, we are able to do it very safely, although the chances of the complications happen very likely, but you can have chronic sinusitis and things like that, which is one of the most common complications that I see. Although you may have some chronic sinus pain and chronic discharge and all of that, these are again like very rare occurrences, in my opinion.